Hello, my name is Sean Mehra. I'm the co-founder and chief operating officer of HealthTap, which is a virtual healthcare technology company. Today I'm going to talk about how the confluence of events in 2020 created the perfect storm that we believe is going to change how healthcare is accessed and used worldwide. Of course, COVID-19 is the major driver, but COVID hit at a time when the American workforce and economy was already in the midst of huge change. The assumption that we get healthcare benefits from our employer, an assumption that we've had for nearly a century in this country, is no longer a reality. In fact, less than half of US companies offer health insurance to their employees in 2020. And today, 43% of US workers are contractors, and therefore not eligible for employer-provided benefits anyway. And technology at the same time has been disrupting big industries like retail, real estate, stock trading, creating new consumer expectations of what is possible. With the backdrop I just described, 2020 brought us this sudden upheaval, including the COVID-19 pandemic, amongst other things. But let's not get started on those. Here's the bright side. In 2020, consumers are empowered with data and technology at their fingertips. They expect on-demand service for everything, as well as complete transparency. It's hard to imagine a bright side of the COVID pandemic, but there is one. COVID forced telemedicine into the mainstream. There's no doubt in my mind that telemedicine saved and continues to save lives by keeping people out of emergency rooms and urgent care clinics where they can be exposed and expose others. Now that consumers have embraced telemedicine, big brains and big money are jumping in to get a piece of it. The result will be healthcare that is more affordable, convenient, and accessible than ever. And it might sound dramatic, but in my mind, the overnight adoption of telemedicine forced by coronavirus will result in major healthcare innovation on par with the invention and impact of antibiotics and vaccines. So in a nutshell, here's what we'll cover today. First, the slow burn, then explosion of consumer-focused healthcare companies in the last decade. Next, the top health concerns of today's worker and how they compare to pre-COVID. Next, how today's workers are using virtual doctor visits. Then I've got some new data on how the HR industry is thinking about telemedicine. And finally, some information for you on how to navigate this complicated environment of health benefits. So a decade ago, I was the ultimate wide-eyed idealist. I think I still am, although I know the year 2020 is trying to seriously challenge me. It's hard to believe, though, that just 10 years ago, consumer-focused health technology companies were rare. During this time, I was in the Bay Area. I had recently graduated with degrees in pre-med and biomedical engineering, and I'd also created and sold some social video gaming companies to get my entrepreneurial career off track. I wanted to work in medicine, but I was a technology entrepreneur. I wanted to figure out how to do both. So lucky for me, just about this time, Silicon Valley was starting to catch on to the idea of consumer-focused healthcare companies, mainly driven by the fact that smartphones and mobile apps were becoming ubiquitous. You have to remember back then, Apple App Store and Facebook were all relatively new things. At this time, medical technology experts who were building back-end technology like electronic medical record software were now thinking about the much sexier area of consumer technology. They started thinking about using technology to transform the actual patient and doctor experience. So what happened? Well, an explosion. The good kind. In the past 10 years, more than 8,000 health tech startups have been founded, including my company, HealthTap. And you can imagine the many different aspects of healthcare that these startups tackle. And most of them believe they can change the world, which is a great thing. Not to mention, I'm sure many of them are trying to get your attention to get their products and services in front of your people. So what did I do? Well, I was lucky enough to meet a group of people who wanted the same things as me. And in true Silicon Valley startup fashion, we cranked away in our proverbial garages, sketching ideas on whiteboards and prototyping new products. In the end, we decided that there should be a healthcare marketplace. Something where there's a supply of doctors and demand from consumers for their knowledge and time. We wanted to create a brand new way for these two groups to transact with each other. But how exactly? Well, one of the first things we realized is that people, when they get sick, and you should think about some of your own experiences, when you have a health question and concern, what do you actually do first? The reality is, we don't immediately call up our doctor's office. We don't pull out our insurance card from our wallet and look up the website or phone number to figure out what to do next. We don't waltz into the local retail clinic or store or pharmacy to find an over-the-counter medication. We Google it. We go online. We search our health question. And what was fascinating to find out when we were early in our journey was that people actually do that way more often than they actually go to a doctor. In fact, just a few months ago, the head of healthcare at Google said that Google sees about 1 billion, with a B, health searches every day. And that compares to 500 million doctor visits in a whole year. That is several orders of magnitude different. What that tells you is people look for health information more frequently and before they look for care. So what do we do about that? Well, we looked at how people felt about their experience on Google. And this is really not about Google per se, but really any health search engine, any search engine on the web. And again, I'm sure you can speak from your own anecdotal experiences, searching for your own symptoms and health questions online, but it usually leaves you more stressed and confused than before, right? Because we have this joke at HealthTap that on the internet, every headache turns into a brain cancer in 2 clicks or less, right? It's very easy to get lost and confused and scared. And the reason why is it's not terribly surprising, When you type your question into that search box, that search engine doesn't know anything about you or your health profile or your medical history, or really even an understanding of the concepts of medicine and how they relate to each other. So it's going to take the words in your query and try to find the words on different websites and present you information from sites that it knows are good. So it's not surprising that you can type in the word headaches and arrive at an article from top academic institutions talking about how headaches can be a sign for brain cancer. That lack of context is a problem. Then you have the next problem, which is there just doesn't exist the content for every kind of health question you can ask. I mean, if you think about all the permutations and combinations of symptoms and ages and genders and comorbidities and all sorts of variations of health questions that any one person can have, that 7 billion people can have, there's no way that there's a post or article created for every single one of those imaginable questions. So when you type in something fairly specific into a search engine, there just isn't a website with the answer to that, and so you're left with trade-offs. You're either on some trustworthy reference articles about a condition or a medication, but rarely do you have the question, what is diabetes? I want to learn everything I need to know about acetaminophen. You usually have a pretty specific question. Is it safe to eat sushi during pregnancy if I'm a diabetic? That is a much harder question to find content for. But that's not to say you can't find content for it. You can, but it often leads to the third problem, which is often when you're looking for a more specific answer to a question, you end up on these discussion forums, social media groups, WhatsApp groups, where you might get a response to the question you have from someone, but you don't know if that response is trustworthy and credible, and you may or may not know if you can rely on the knowledge of the individual providing the response. And that's scary. I mean, we know that one of the other big issues of healthcare today is all of the misinformation floating around about issues that the scientific community has consensus on, but the internet has created a lot of confusion around. And this is a problem Google itself has admitted throughout the years. It's a very hard problem for them to solve alone. So what do we do about it? Well, that's where we came in. The problem is that search engines are good for many things, but diagnosing healthcare issues is not one of them, and answering your health questions is not one of them. So what did we do? Well, here was our big idea. Our version of a healthcare marketplace was essentially a medical search engine in which all the information is provided by real doctors and is personalized to the individual searching for the information. A tailored answer to the specific question you're asking, provided by someone that is the ultimate source of trust and knowledge in healthcare. So the goal was to make doctors' knowledge instantly accessible at scale within seconds for free. Then users can vote up or vote down content via reviews and thank yous. Doctors can peer review each other's content and demonstrate where they have consensus in the medical community and where doctors have alternative opinions on different or more holistic ways of thinking about an issue or a question. And so to do that, two key components work together. First, the ability to ask an anonymous health question and get a personalized answer from a board-certified doctor in 24 hours or less. Second, the ability for anyone to search this content for themselves. So today, HealthTap's Doctor Q&A has millions of searchable questions and answers, and it's growing daily. And that's kind of fascinating. It's not necessarily novel in and of itself. If you think about it, solutions like this have existed. You might have heard of products like Yahoo Answers, which used to be really big back in the day. You have sites today like Quora. But there's a lot of models where you can essentially crowdsource answers from a community of experts. If you think about it, Wikipedia is like that too. You have these volunteer experts who are sharing their knowledge without compensation. Why would they do it? Well, because they want to do good. They want to share their expertise with the world and create a valuable resource for humanity that makes trustworthy information more accessible for billions around the world. They're democratizing access to education and information. That's really all we're doing. We're just saying that that knowledge and information in healthcare needs to come from providers who have been trained in being able to answer those questions. And it really just came down to creating an experience where you create the right forum where only those experts can answer, with sufficient motivation for those experts to answer them, right? And for doctors, it's been a lot of altruism, doing good, helping others, and a lot of other intrinsic motivations like enhancing their own online reputation, becoming more discoverable, perhaps attracting new patients to their practice, gaining recognition from their peers, learning from one another, and advancing their own knowledge. So a lot of different reasons why they do it, but the end result is pretty cool. Now here's a destination, an app, a service where instead of those 1 billion health searches a day on Google that lead to confusion and more anxiety, now you have a destination where you can begin your health journey when you begin with an informational question before you decide to see a doctor, and you can get many times a completely satisfactory and trustworthy answer to your specific question, personalized to you, and that's that. You've saved the whole system and yourself lots of time and money. So what does this end up looking like? Well, What you essentially have done is taken the supply and demand marketplace. You have this demand of consumers coming in, millions at a time, asking their health questions, and then this supply of physicians, tens of thousands at a time, across hundreds of specialties, answering those questions. But of course, it's not just about information in healthcare. You also have the care piece. So it may start with the transaction around, could you educate me, inform me, and guide me about, is this serious? Should I be worried? What should I do next? But many times it does lead to the next step, which is, all right, now tell me what's wrong with me. Diagnose me, treat me, prescribe me the medication, order the test I need, and tell me what I need to do next to make this pain go away. And so that leads you to the second pillar of this whole marketplace, which is providing the care piece. And then the third and final pillar in this marketplace is the fulfillment. It's the what happens finally. So the doctor gives you his or her orders and says, here's what you need to do, here's what you need to take. Now you need to go do them. That means you need to go and pick up your medication, make sure you get the right medication that you can afford. You need to go and get your lab test collected and resulted and discussed to figure out what could be going on. And you need to follow the regimen, whether that's taking those meds or following up with the doctor in a couple of weeks, or maybe just doing that therapy and exercise every morning. So on we go. The great thing about the Q&A library is that you can get a sense of what's on the minds of America's workforce. And I thought I would share a bit of that with you today. I figured it would be interesting to compare actually September 2019 to September 2020, kind of before and after the pandemic. So who can guess the top 3 most common topics that consumers ask doctors? Right. This is being taped, so I can't interact with you guys, unfortunately. But let me just go ahead and tell you. In September 2019, the top 3 topics were, drumroll please, sexual health and STDs, back pain, sleep. Maybe a little bit surprising, but also kind of not. Fast forward a year, deep into the pandemic, and what are the top 3 topics? Sexual health and STDs, headaches, and children's health. It's interesting. But wait, aren't we in a pandemic? Where's COVID-19? Well, it turns out it's number 5 on the list. So this tells us that people use doctor Q&A a bit differently than you might think. It's especially helpful for talking to a doctor about things where you want to be anonymous, perhaps, as well as non-urgent medical matters, and topics where you're not sure you want to run to the doctor right away. So then, obviously, you ask, how are people using virtual doctor visits when they actually do need care? Is it different from how they're using the Q&A? Is it different from last year to this year? Well, let's find out. In September 2019, these were the top 5 reasons for virtual doctor visits. Seems about right. We were anxious in 2019, even pre-COVID. But what about September 2020? Boom, here we go. Not surprising, COVID-19 is number 1. And we're still struggling with UTIs, noted. But obviously, flu-like symptoms really worry us and get us in front of a doctor right away. Not surprisingly, anxiety is still up there and people struggle with sinusitis and allergies regardless of a pandemic. So, as we continue to expand HealthTap's role in providing healthcare, we learned something else. People aren't good at following those doctors' orders, even after they speak to those doctors about these types of topics. They forget important pieces of what the doctor said. They're overwhelmed with the volume of information they just got, or they write down the information and lose the piece of paper. Sometimes these days you write it in your notepad on your iPhone and forget to check it because we're busy. Oftentimes people understand what they're supposed to do in the moment, but they forget. Life gets in the way. But technology can help here too. Using technology, doctors' orders can get recorded in real time and stored online. Patients who have access to all of their doctor's notes from a virtual visit, which are automatically turned into treatment plans, can have, coupled with them, automated reminders and checklists for patients. No more paper, no more forgetting, and everything is on your phone, and it's not waiting for you to look it up in your busy life. It gets pushed to you, even when you may have other things on top of mind, so you don't forget to take that medication or complete that exercise or show up for that follow-up appointment. This leads to better outcomes. Now, I just mentioned a topic briefly about online medical records and data. And that's another topic filled with buzz and fraught with controversy for a long time now. A lot of tech giants like Google with Google Health, Microsoft with Microsoft Health Vault, and now Apple with Apple Health Records have launched a lot of these consumer health record platforms. But the reality is none have achieved the level of consumer adoption these companies expected or hoped for. At least not yet. And why is that? These companies are some of the most successful and smartest companies in the world, especially when it comes to creating consumer applications. So I think there's two main reasons for the lackluster adoption. One, it's just a lot of work to aggregate your own health records. And the immediate benefits are unclear to the average consumer to spend all that time calling up all your doctors, getting a dump of all your files, figuring out how to scan them and or take this CD and upload it somewhere, or I'm sure you all can relate. And for what reason? Well, that leads me to problem number two. None of these platforms actually provide your medical records and other data to a doctor at the time of care. It's really great for journaling and having your own data at your own fingertips, but there's really not much you can do for yourself with your own medical records. The people that really need it are your providers. And we know that despite these platforms existing today, it's not that easy for one doctor in one office to access the medical records of one of your other doctors in a completely different practice or office. That's beginning to change, but until it becomes more widespread, it's really going to be difficult for any of these consumer-owned health records to take off. And we think once you can integrate that medical record interoperability in the same flow, that you're getting personalized answers to your questions, personalized doctor visits, and personalized care plans, that it's going to be really hard to compel consumers to take the time to pull in all their records into one place. Now, many companies, including HealthTap, of course, are trying to solve this problem. The goal is automate as much as possible so patients and doctors don't have any additional steps. Recording and storing data should just happen in the background. And the next piece is to make it trivially easy to aggregate your health records from multiple sources in one place that is accessible 24/7 to patients and doctors. And again, this is very important. Delivered at the time of care, regardless of what doctor you're seeing, where you're seeing her, or how you're seeing her. And of course, we can't discuss all this digital healthcare without touching on artificial intelligence. There's a lot of controversy over this topic as well. AI developers, and we hear it all the time, make all sorts of marketing claims to us about the accuracy of their algorithms, but then they rarely publish transparent, peer-reviewed papers on the methodology of measurement, and they almost never use some common set of benchmark tests so that we can fairly compare the performance of different algorithms from different companies or developers. It's also true that there's inherent bias in people who are writing the AI algorithms, which makes them imperfect. There's also bias with the data being collected. Oftentimes, the people who have high-end devices and use them for healthcare and contribute to these training data sets may not demographically represent the general population. But there are serious problems in healthcare where AI can help. You know, a Johns Hopkins study says that medical error, this blows my mind, medical error is the third leading cause of death in the US, behind heart disease and cancer. I mean, let that settle in for a second. It almost makes you appreciate the value of a second and third opinion and how much we may want to consider that more regularly in the course of our healthcare. But on the flip side, you start seeing other signals. A JAMA study says that AI, even with all its flaws, outperforms radiologists for spotting breast cancer and raises fewer false alarms. In fact, HealthTap conducted a study that also had a pretty dramatic finding. We found that when a HealthTap doctor has our AI evaluation at the time of the doctor visit, in that our AI suggests to the doctor what it thinks the diagnosis could be based on the consumer symptoms, the doctor is 45% more likely to give a more accurate diagnosis than without the help of that AI suggesting what it could be. That makes you think about a world where it's not AI or a physician. It's not artificial intelligence. Maybe it's this idea of augmented intelligence, where the combination of man and machine, a doctor and an AI algorithm together, are more powerful and more effective than either one alone. So we know using a machine to do manual tasks rather than a human reduces error and increases efficiency. But if an AI can spot tumors and increase the accuracy of diagnoses, imagine what it could do even more broadly applied across healthcare. And many people are. Maybe medical error wouldn't be the cause of 10% of all deaths in the US every year. So I've told you that people being forced to use telemedicine is going to change all of this. I completely believe this to be true. But what is the path to get there? I can tell you now, it's going to be challenging. As we look to the decade ahead, the opportunity lies in integrating multiple and disparate systems in healthcare and data sources in a way that is low friction for consumers and providers. What you begin to see is a picture of an end-to-end seamless consumer healthcare journey in which all the pieces are connected in a way that dramatically increases the efficiency and convenience, reduces miscommunication errors, and brings all the data in one place to help man or machine make the right decisions. Also, because this integrated experience is direct to consumers using technology, it spurs competition amongst those technology providers and care providers and payers to be the highest quality at the lowest price. Again, whether you're a health insurance plan or medication or test or medical device, we're going to need to earn the business of the consumer. And the industry is converging on this vision. There is a loose agreement amongst pretty much all players that there should be what they're calling a quote-unquote digital front door for healthcare, which will let consumers and providers easily access and navigate various types of care, providers, methods of payment, and more. And this idea of a digital front door will create opportunities for companies to make a lot of money, which is why so many investors and tech companies are flooding into the healthcare space. It's probably not surprising to you, but here's how big it is. The US spends almost $4 trillion with a T a year on healthcare. Yet, at the same time, by some measures, at least 2/3 of ER visits are unnecessary or non-urgent. So you have massive spending and pockets of tremendous waste and inefficiency. On top of that, most of the 500 million primary care visits that Americans have every year could probably be replaced with virtual visits. And I would even venture to say that a good percentage of those could be replaced with self-serve information in a Q&A forum with doctors, and perhaps even AI guidance. Now, this huge commercial opportunity, again, is no doubt going to create lots of wealthy people and companies, but it, at the end of the day, is also very good for consumers because they will benefit from better experiences at lower prices. So if so many people are going to make so much money when they figure this out, why hasn't anyone in this great capitalist economy done it yet? And as I kind of already hinted, it is complicated. You know, all these attempts, like some of the ones I mentioned, like Google Health, even Google Helpouts, Microsoft Health Vault, a lot of these were all shuttered. These were launched and then pulled back. Even Amazon's hyped joint venture with JP Morgan and Berkshire Hathaway called Haven has been in the press as struggling to bring this vision to life. Apple Health Records is a really interesting prospect of integrating all our health records and putting them in the hands of consumers. But it, like I said, has yet to achieve meaningful adoption and integration with providers in their workflow to make it useful for consumers. But a marketplace like this could offer up a variety of options with transparent pricing and consumer reviews, which could be booked and paid for through the platform. Consumers could potentially start not by searching for products and services like you do on, let's say, Amazon. Instead, maybe you start with a symptom or a concern. And whatever this digital front door platform is, it would then guide them to the best healthcare products or services for their needs, whether that's a pregnancy test or a heat pad, a telemedicine visit, or a procedure. And the competitive moat for whoever builds this digital front door would deepen as the brand of this app and online destination grows stronger in healthcare, and the technology continuously improves at processing people's questions and queries and cases, triaging them to the right place using AI, and matching consumers ultimately to the right goods and services that will help them the most. You know, building this marketplace really requires holistic thinking, operational excellence, sheer will, probably a lot of time and investment. It should enable access to urgent care, like a lot of telemedicine does today, primary care, which is where a lot of virtual care is headed, specialty care, as we're beginning to see the importance of things beyond primary care, like mental and behavioral health, and so on and so forth. It should enable access to meds, labs, whether that's care that's provided virtually, items that are shipped to your home, or sites of care that you need to go locally. You know, I do believe that major players will have to collaborate to unlock this vision, to usher in a new era of healthcare that is more suited to our modern workforce and economy and our consumerized expectations as a country. And I'm relatively certain there will be a handful of national brands that become this go-to online destination and one-stop shop for most of our everyday healthcare needs. The reason that this is most likely the future, despite all these challenges, is because we can learn from history that this is a path that has been paved many times before by other technology companies. It's just not yet happened in healthcare. I don't know if anyone here has heard about it, but there's a neat little theory called Aggregation Theory, and it was really created and coined by someone named Ben Thompson, a strategy blogger. And he explained why internet companies like Amazon, Google, Expedia, Netflix, and Uber transformed their respective markets. The superpower of these companies, or so-called aggregators, is they get a whole bunch of consumers to start using their app and services. And they disintermediate those suppliers who used to have direct customer relationships with these consumers. And now, as the powerful middlemen, they make those suppliers compete by creating higher quality services at lower costs. And they offer a more complete selection and a better experience for their consumers. Think about what Google did to online publishers, what Napster, iTunes, or Spotify did to music labels, what Apple did to mobile app developers, what Netflix has done to Hollywood studios, what Uber has done to taxi companies. You get the point. The same will be done for healthcare. Those with the best online experience will attract the most consumers and thereby attract the best suppliers. Again, whether that's telemedicine services, clinics, devices, medications, lab tests, even insurance plans. And those that offer the best value products and services will win, competing equally in an open marketplace amongst their suppliers, competitions. Just to drive this point home, which I think is really fascinating, we can look at one of the most successful examples of aggregation theory at work, Amazon. Many of you may remember they began as a bookstore back in the day. And then they went into all sorts of verticals where they said, well, it's not just books, but toasters and computers and, all sorts of things. So they have this famous Amazon flywheel. And in it, they outline the virtuous effects of aggregation and how it drives a continuously better experience in business for them. In a nutshell, you create a lower cost structure by operating at scale. It creates efficiency. It helps them lower their prices. Those low prices attract more consumers, which attract more suppliers to try to sell to those consumers, which drives competition amongst those suppliers, which lowers the prices more, which gets more consumers, which lowers their cost structure more, and so on and so forth. And what you really end up with is this destination with enormous selection and supply, with great service and really good prices. And this is the winning formula. At the end of the day, there will be solutions that bring all of these pieces together. For one, it'll be a solution that starts with information, creating a trusted source of medical information and guiding consumers then to the right care. An open marketplace that offers a wide selection of goods and services like telemedicine and local clinics and specialty centers of care and different ways you can pay for that care and pharmacies and tests. They'll build a consumer brand that attracts consumers and creates loyalty, which will lend itself to even more growth in word of mouth and social sharing and cost-effective national advertising, a virtuous flywheel that eventually will earn them a spot on all of our home screens, right? We have an app to order our groceries and a taxi and check our email and scroll through a feed of our friends' personal lives, but we don't yet have that app we tap on anytime we have a health question or concern and need care. That's what building this consumer brand will change. And this solution will also make storing and retrieving medical records trivially easy by reducing the effort needed to store and pull those medical records across institutions and incentivize them to do this and put it in front of doctors at the time of care. And finally, it'll connect everything for the consumer by making sure that those records and prescriptions and treatment plans and virtual in-person appointments are all accessible to us as consumers 24/7 and providers. So who's going to do it? Who's going to create this? Where are we going to get this from? Well, when you look at every sector of the healthcare industry, there's no real clear answer as to what company is going to do it or maybe even do it alone per se. I mean, I just talked about many of those who are trying. If you just go around the horn, you have traditional retail. They don't usually have the tech chops to create awesome apps, but they do have lots of consumers already shopping at their stores for all sorts of things, including healthcare products. Then you have the tech giants. They don't have the healthcare industry knowledge and relationships, but they sure know how to build digital consumer experiences at scale that we love and most Americans are already using on a daily basis. Then you have enterprise software companies. They're not usually the best at building consumer brands and experiences, but they do have deep integrated relationships with those insurance companies and providers to integrate with the data and workflows necessary to enable this vision. And finally, you have this explosion of health tech startups, but they don't have the brand awareness and trust to make big deals quickly. They may not have the cash to build mass audiences. However, they are often the most agile, innovative, and incentivized to disrupt the status quo. So it'll be really interesting what combination of these different entities will end up working together and putting all the pieces in place to enable this vision that the industry is converging is going to happen and is just a matter of time, despite the challenges. So let me take one more minute to summarize what we've learned so far. The industry has been talking about the consumerization of healthcare, which many take to mean building better consumer experiences. But being a consumer means being in control and being empowered with selection and choice about how you spend your money based on what you find valuable. With America already on the path of a more gig economy workforce, with the pandemic adding millions of more Americans in this bucket through furloughs and unemployment, this group of people who essentially have to pay for their health care out of pocket because either they don't get health benefits from their employer, they never purchase their own health insurance, or simply have a very high deductible insurance plan. This means healthcare now needs to be delightful, convenient, and affordable. All the things consumers look for when they decide where to spend their money. And these consumers are no longer our country's W-2 full-time employee workers. These are all Americans, regardless of the type of employment they have or lack of employment. Next, we learned that while there is so much hype about telemedicine, the reality is that telemedicine alone is not enough. Consumers actually seek information before they seek care. When they seek care, while virtual care is often preferred, it is not always sufficient. So we need guidance to the appropriate local, in-person, or specialty care. After that care is provided, we need continued guidance in helping us adhere to the care plan until we get better. And all of this can be enhanced with an AI that guides consumers and our providers efficiently, and enhanced by complete medical records that are shared by all providers and these algorithms at each step of the way to provide continuity of our experience and the kind of personalized high-quality service we've grown accustomed to in most other aspects of our lives outside of healthcare. And so as we move forward, we need to think about not all the fragmented point solutions designed with enterprise customers in mind, and instead start focusing on holistic, complete integrated experiences with consumers in mind. Okay, so you're thinking, good luck with all that, keep me posted, but what do I do now to keep my workforce healthy and reduce healthcare costs? Well, 2020 has shown us that virtual care is a big part of that picture. Here's some interesting new data that came up in a survey we just ran this week amongst HR and benefits leaders across the country from organizations of all sizes that HealthTap conducted. The first finding was 81% of respondents that offered telehealth to employees would also be open to offering a solution to part-time workers and contractors. So there is a growing awareness that there is a body of our workforce that is not getting access to healthcare the way the rest of the workforce is. Interesting. 75% of respondents who currently provide telehealth to workers believe that people are more open to using telemedicine due to the pandemic, and it will become a standard part of medical care moving forward. And finally, the lack of speed and long wait times are the biggest pain point with current telemedicine providers, with 41% wanting faster access and shorter wait times. I know many people in this audience probably already have an existing telemedicine provider, but our data shows that 60% of you are considering a change. For those folks, here's 3 expert tips on that process. Make sure that when you're comparing usage rates, engagement, utilization, pricing, and features, that you're comparing apples to apples. Most of these telemedicine vendors measure these numbers a little differently. They'll use similar sounding words with very different methodologies of measurement. You have to ask questions. Is this average monthly number, average yearly number? Is it usage percentage, calculating the number of visits or the number of people who did visits? Is it a virtual visit, text only, or is there a video option as well? Just really get into the details. Go beyond the slideware. Wait times and hours of accessibility for seeing a doctor are also a key factor. Technical capacity for large numbers of people has been a problem for a lot of even the large telemedicine providers, and that was really exacerbated by the demand spike during the pandemic. So get verifiable data for wait times in peaks and valleys. Make sure you're comparing wait times for the same parameters, such as when a visit is first requested by the user to the time they're live with the doctor. And are they live in some kind of email or text exchange, or is there a real face-to-face happening? And finally, check in on the quality of care, including if it's provided by doctors or only by nurses, or maybe both. Find out the doctor credentialing process. Where are these doctors based? Look for terms including active, unrestricted medical license in good standing, as well as board certification. Understand the doctor training program and whether or not the provider requires a specific approach to care from their doctors. We also, to help you out, prepared the top 10 questions to ask a potential telemedicine vendor. And don't worry, I'm not going to read them all to you. You can find them and all the information I presented today on our blog at healthtap.com/blog. But, these questions include things like I said, availability, wait times, but also ongoing engagement and usefulness. How is this app or service going to be useful for my people between the episodes where they get sick once or twice a year? How is it going to provide utility in their lives more than every 6 months, in other words? What other features and services do you bundle with this that are synergistic with the telemedicine, that collectively make the entire experience better and more convenient? And then, of course, really dig into the pricing and ROI of the investment to help you compare the value of different service providers. Well, that's it. Thanks for sticking with me. And on behalf of everyone at HealthTap, I just want to thank you all for the work that you are doing to care for and provide access to care for the everyday people that keep this country running. We know that the past year has been incredibly difficult for people in your field, and I personally wanted to just acknowledge that with my gratitude. As airlines used to say back when flying was normal, please place the mask over your own mouth and nose before assisting others. That means be well and take care of yourselves first and foremost. We need you all happy and healthy so you can pay it forward by getting the right benefits and solutions for others in your organization. Thank you, be well, and enjoy the rest of the conference, and I'd be happy to take questions.